A good day again, everyone. So, this is the fifth installment of our lecture on radiographic anatomy. So, again, you have to study this early so that you will have more time to study and learn about it because sa next meeting we will once again have another quiz, okay? So, if you are not yet finished with the previous slides or the previous videos, so you have to watch them over so that you will be able to understand the terms we will be using uh, as we go along with our discussion. Okay, so let's start. So we are now on the surface anatomy and landmarks. So, surface anatomy is the study of the features of the body, especially the features that are very important and are most commonly used in our field in the radiologic technology, especially during positioning of our patients for radiographic examinations. While surface landmarks, so sometimes sa ibang reference books, they are referred to as anatomical landmark or sa other books naman, topographical landmarks. So it is a biologically meaningful point in certain part of the body. So these are landmarks, these are very important points in the body that you should be able to learn because you are going to make use of them not just in this class but also in your other subjects as you go along, especially when you encounter your radiographic positioning, special radiographic procedures, and other radiological sciences. So these are very, very important landmarks. So the skull radiography, or sometimes it is also referred to as skull films. They are recognized to be among the most difficult to interpret because of the complexity of the bony construction and arterial as well as venous markings in the diplo, all of which may mimic fracture. So, ibig sabihin, ang skull radiography or ang skull films, so they are one of the most difficult parts of the body to interpret, especially when it comes to radiographic examinations. So, yung mga radiographs niya, yung pictures niya, yung images niya, yung mga examinations niya, so medyo mahirap siyang i-interpret because of the so many complex anatomy that are inside the skull. So sometimes, so the term diplo, we will discuss that on the succeeding slides later. So these markings, including the bones, the joints, the sutures, the arteries, the veins, they may mimic fracture. So, ibig sabihin ng mimic, parang, what do you call this? So, magmumukha siyang parang fracture. Pero actually, they are normal markings in the skull. So, sometimes pwede siyang sabihin ng mga doktor, ma-misinterpret or ma-misdiagnose siya, especially if yung radiologist ay bago pa lang. So, sometimes it can be misinterpreted into a fracture where in fact it is actually a normal structure. Okay, so the fractures of the skull base, so the base of the skull, are important because of the risk of CSF that may leak and spread the infection towards the intracranial contents. So, kung ibig sabihin, kung may mga fractures na makikita or nandun sa base ng skull, they are very, very important to be diagnosed as early as possible kasi pag hindi siya na-diagnose na maaga, yung fracture magiging cause siya ng pag-leak or pag-spread ng CSF papunta sa intracranial contents, and it is a life-threatening condition. So the good understanding of the anatomy as well as the relationships of the bones and the structures of the skull are very important or essential. The skull or bony skeleton of the head, so skull or bony skeleton of the head, rests on the superior end of the vertebral column. Again, pag sinabing superior, pinakamataas. So, ibig sabihin, yung skull daw natin ay nakapatong sa pinakamataas na vertebral column, which is what is the first vertebra here? That is the C1 or the first cervical column. So this is an example of an X-ray of the skull. So we have here the sagittal suture. We have the frontal bone here. We have the frontal sinus here. The crista galli here. The ethmoid sinus. So, pag sinabing sinus, they are hollow and they usually contain fluid, normal amount of fluid. The superior orbital margin here, the petrous ridge, as well as the inferior orbital margin. So, don't worry if you are not very familiar with this anatomy, especially when looking at the radiograph, because it is normal. You will be able to tell the difference between the different structures of the skull kung matagal ka nang nagtatrabaho or matagal nang ito yung ginagawa mo. So, familiar ka na. So, pag hindi naman, since you are still students, so I know it will be difficult for you. So, what we're going to learn here in our subject is their description. So, not necessarily the actual parts of the body or the skull in the radiograph. So hopefully, at the end of our semester, so you will be able to identify some parts. Kahit some parts lang. I am not expecting you to identify all these parts in the radiograph, okay? So this is just the introduction. And as you go along, when you reach your third year, as well as when you have your internship, so you will be able to identify the different structures of the body or the anatomy in the radiograph. So, sa ngayon, so we will just focus more on the description. So, we have here, so this is the back portion. So, we have the parietal bones. So, they are left and right. The lambdoidal suture here. We have here the foramen magnum, the occipital bone, the petrous ridge, the clinoid process, the petrous ridge, mastoids, dorsum cellae, etc. So, each of these structures will be discussed on the succeeding slides, okay? The different structures in the skull of a human individual. So we also have different structures that can be seen when the patient is in lateral projection or also lateral view. So different projections, AP, PA, lateral, oblique, will also present different structures. Kasi may mga ibang structures na hindi mo makikita sa AP projection, pero makikita mo siya sa PA or sa lateral projection. So, hindi lahat ng structures makikita mo sa isang projection lang. That is why may mga ibang examinations na more than one yung kanilang projections. So, merong iba PA lang, yung iba naman may PA na, may lateral pa, minsan may oblique, may Caldwell, may Waters, etc. So, the divisions of the skulls include the cranial bones and the facial bones. So, our skull here is divided into cranial bones and facial bones. So, we have 8 cranial bones and we have 14 facial bones. So, we have here the cranial bones, also referred to as the neurocranium, and the facial bones is also referred to as the viscerocranium. So, the purpose of cranial bones is to protect the brain. So, they act as a protective housing for our brains. While the facial bones, so they contribute to the shape and form of a person's face. So, yung korte ng ating face, so it differs depende rin sa construction or size and shape ng facial bones natin. So, aside from contributing to the shape and form of a person's face, facial bones also helps protect the upper ends of the respiratory and as well as the digestive tracts. So, kung ang cranial bones natin serve as protective housing for the brain, yung facial bones naman natin serve as a protective housing for the upper ends of the respiratory as well as the digestive tract. So, ito yung facial bones, so they can also protect the upper portion of our respiratory as well as our digestive tracts. So, another picture to introduce you the anatomy of the skull. So, again, it's divided into neurocranium here. Then we have the facial bones here. So, the neurocranium or the cranium is composed of calvaria or the skull cap and the cranial base or the base of the skull or the basicranium. While the facial bones, they are also referred to as the facial skeleton. So another picture to represent, we have here the cranial bones. So these are the cranial bones. So cranial bone siya. Ito yung mga pangalan nila. We will also discuss this in a while. So we have 8 cranial bones. We have 1, 2, 3, then we have 4, then we have 5. So parietal bone is left and right, so 5 and 6. Temporal bone is also left and right, so 7 and 8. So we have 8 cranial bones, then we have 14 facial bones. So sa picture, we have here the maxilla, the zygomatic bone, the nasal bone, lacrimal, vomer, mandible. So may mga iba pang facial bones which are not included in this picture, but they are also considered facial bones because again, there are 14 facial bones. So we will also learn that on the succeeding slides. So as I have mentioned earlier, so 8 cranial bones and 14 facial bones. So another representation, so we have here different structures which we will also discuss one by one in a while. So here, okay? So they are all labeled. So I think in your anatomy class last semester, I think you have already learned some of those structures hopefully. So again, so the skull are made up of 2 tables. So 2 tables, the external and the internal tables. These tables are made up of compact bone. And these tables, the internal and the external tables, are separated by a layer of spongy bone called the diploe. So meaning, diploe is defined as a layer of spongy bone which divides the external and the internal tables of the skull. So, yung tables natin, yung external and internal are made of compact bones. And between the external and the internal compact bones are a layer of spongy bone called diploe. So, we have mentioned the term diploe sa previous slides. So another term, very important term, is what we call the periosteum. So periosteum, so peri is surrounding or around. So it covers the outer as well as the inner surfaces of the skull. So yung ibig sabihin, yung periosteum, it is a covering of the outer as well as the inner surfaces of the skull. So, if it covers the outer layer, it is called the pericranium. If it covers the inner layer, it is called the endocranium. So, endo meaning inner or inside. Okay, so peri is outer or around. Okay, so take note also that periosteum is different from pericranium. Periosteum is a generic term. So, we have here periosteum. So, under that, we have pericranium and we have the endocranium. Okay? So, periosteum, covers the pericranium and the endocranium. Pericranium is a specific layer that covers the outer layer of the skull, while endocranium covers the inner layer. So we have here a picture of what we are talking about just a slide ago. So we have the periosteum here, the outer and the inner layer. Or yung tinatawag natin kanina na tables. The external and the internal tables. They are made of compact bones. And between these external and internal tables, or between the periosteum, is what we call the diploe, which is a spongy bone. So, sa pericranium, so again, pag sa outer layer, yung kinakover niya, it is called a pericranium. Pag sa inner layer naman, it is called the endocranium. Endocranium is sometimes referred to as the dura mater. Okay? So again yung ating outer and external tables or ang ating periosteum, they are made up of compact bones. Yung diploe, spongy bone. So let's discuss first the cranium. Before we discuss with the facial bones, we will discuss first the cranium. So cranium is divided into upper and lower portions. Upper portions include the calvarium, or sometimes sa ibang reference books, it is called a skull cap or the skull vault. Okay? So, they mean the same. Either calvarium, skull cap, or skull vault. For the lower portion of the cranium or the skull, it is referred to as the floor of the cranium or the base of the skull. So we have here the calvaria. So they are bones forming the walls as well as the dome of the brain case. Ito, yung upper portion niya. So this is the line here that divides the upper portion and the lower portion of the brain. So again, the upper portion is calvaria, skull cap, or skull vault, and the lower portion is called floor of the skull, base of the skull, or basi cranium, from the word base. So they are bones forming the floor of the cranial cavity. So when you open this one, when you take away this upper portion, you will see here the base of the skull. Okay, so we have here the different parts of the base of the skull. Then we have the calvarium, the skull cap or skull vault. So they are composed of 4 parts. So we have 4. We have the frontal or parts of the frontal bone. Kasi may ibang parts ng frontal bone na kasama din sa base of the skull. So, both parietal bones, the left and the right parietal bones, as well as the occipital or parts of the occipital bone. If you can remember, dun sa slide natin sa previous, so para siyang line dito. So, definitely, there are parts of the frontal bones that belong to the base of the skull, as well as parts of the occipital bone that belongs to the base of the skull also. So basically, again, the 4 upper parts of the cranium are the frontal bones or parts, majority, I guess. So majority of the parts of the frontal bones, also majority of the parts of the occipital bone, as well as the left and right parietal bone. So for the lower parts of the cranium, so again, parts of the frontal bone, parts of the occipital bone, so parts of the parietal bone. We also have temporal bones, left and right, the sphenoid and the ethmoid. So, yung frontal bone, parietal bone, and the occipital bone, parang nahati sila. So, hindi siya equally na 50% ang hati, but there are majority of the parts of frontal, occipital, and parietal bones belong to the skull cap, while the rest of their parts belong to the base of the skull. So, let's start with the frontal bone. So, it forms the anterior third. So, kumbaga yung one third niya is nasa uh, yung one third ng ating cranial bone dito is composed or consists of the frontal bone. It also forms the forehead as well as the superior part of each orbit. So, sa taas ng orbit or eyes, so sa taas nito as well as this part sa noo, so they are called the frontal bones. It has a cavity. Pag sinabing cavity, cavity is a hollow portion. So this is letter O, hollow portion, cavity. It has cavity containing the frontal sinus, which is posterior to the glabella. So later we will discuss what glabella is. So basta yung frontal bone natin, may cavity siya, and that cavity contains the frontal sinus. So, minsan, pag masama yung pakiramdam natin, so na yung may ibang fluid na pumapasok sa frontal sinus natin, kaya medyo nahihirapan tayong huminga or yung pagsasalita natin is also not normal because of that fluid that enters the sinus. But also the frontal bone articulates. When we say articulates, it joins. So, articulates with other four cranial bones. So, meaning, connected ang frontal bone natin sa right and left parietal bones. So, that is 2. So, this is 1. So, 1, 2. So, right and left parietal bones. Sa sphenoid, number 3, and sa ethmoid. Okay? Again, frontal bone natin. So, connected siya sa right and left parietal bone, sa sphenoid, tsaka sa ethmoid. It also articulates with 8 facial bones. So, we will learn more on that later. So, the frontal bones is divided into two main parts. We have the squamosal or squamous and the orbital or the horizontal portion. So, the vertical portion of the frontal bone or the squamous or the squamosal part, it forms the forehead. So, majority ng noo natin, they are made up of frontal bones, specifically the squamous or the vertical portion. While yung sa taas lang, medyo superior part lang siya ng orbit o ng eyes natin, they are called the horizontal or the orbital portion. Okay, so I have a picture sa next slide to make you understand this part better. So ito siya. So we have here the frontal bone. Ito yung pinaka-frontal bone natin. Then we have here the squamosal part. Ito siya. So, vertical portion siya. Ito ha, squamosal part. So, vertical portion siya ng forehead. And then we have the makita. So, this is the orbit. Ito yung orbit natin. So, just above it, we have the horizontal portion. Okay? So, ito, squamosal portion or the vertical portion. And this one, the horizontal or the orbital portion of the frontal bones. So, ito yung sinasabi kong glabella kanina. So, ito siya. So, just above the center of the two eyebrows. So, ito yung eyebrows natin. Ito yung center niya. Just above it is what we call the glabella. Glabella is a smooth prominence. Pag sinabing prominence, medyo nakausli siya. Medyo, tawag dito. Parang prominent siya, parang may nakaprotrude dito. If you can feel your forehead, so you can feel your glabella also. Between the eyebrow and just above the bridge of the nose. So, yung bridge ng nose natin, so just above it, we have here the glabella. Another part of the frontal bone is the supraorbital groove or the SOG. It is a slight depression. Pag sinabi naman depression, parang opposite siya actually ng prominence. Pag yung prominence is naka-protrude, depression naman is parang, ano man tawag doon? Parang shallow, hindi ko alam yung term. Basta, pag prominence, naka-usli, naka-protrude, medyo bumubukol siya. Yung depression naman is parang, yung curve niya is paloob. So, it is a slight depression above each eyebrow. So, ito yung eyebrow natin. Just above this, if you can feel your eyebrow, sa taas lang niya, parang may depression dyan, naka-depress. So, that is our supraorbital groove. Tandaan nyo, above siya ha, kasi supra. So, above the orbital groove. So, it is at the level of the anterior fossa. Pag sinabi naman nating fossa, para rin siyang cavity. So, hollow area siya of the cranial vault. It is also the same level as the orbital plate, which you will see later sa picture. And the SOG is the highest level of the facial bones mass. So, ito yung facial bones natin. Halimbawa, yung pinakataas niya, pinaka-highest portion niya is the supraorbital groove. So, remember ha, these parts of the frontal bones and other facial bones and cranial bones that we will discuss here, they are very important, especially later when you have your radiographic positioning. So, kung sa ngayon pa lang, medyo familiar na kayo, so at least, pagdating ng positioning nyo, so it will not be that difficult na because you have already an idea. Another parts of the frontal bones are the squamous or the squamous. So, it includes the supra. Again, supra is above. Kanina, we have the supraorbital groove. This time, we have the supraorbital margin. Kanina, we have the SOG or the supraorbital groove. This time, we have the supraorbital margin. So, it is the rim. So, for example, ito yung eyes natin. So, here, yung margin niya, we have the supraorbital margin. Okay, sa SOG naman, so we have the eyebrows here. So, yung supraorbital groove is here, just above the eyebrow. Supraorbital margin, so we have here. Sa ilalim naman siya ng eyebrow, pero nasa taas pa rin siya ng orbits. It has a small hole opening, medyo may butas siya dito, called the supraorbital notch or the supraorbital foramen. Pag sinabing notch or foramen, parang butas siya. So, ang purpose ng supraorbital notch or ng supraorbital foramen is it serves as the gateway. So, dinadaanan siya ng mga arteries, ng blood vessels, and other nerves. Okay? So, ang purpose niya is it serves as the gateway or passage or path ng ating arteries, blood vessels, and also nerves. Another term, we have the superciliary ridge. So, superciliary ridge here. So, para siyang groove, ridge of bone on each eyebrow. So, if ito yung eyebrow natin, so if you can feel your eyebrows, yung kilay nyo, so medyo matigas siya, so we call that the superciliary ridge. Okay? So again, para mas malinaw, ito yung mata, for example, ito yung kilay. Sa taas, perfect yung kilay. So, galit na galit ang kilay. So, sa taas ng kilay, so may depression dyan, we call that the SOG. Dito naman, or the supraorbital groove. Dito naman, sa orbits, sa taas niya, we have here the supraorbital margin. The superciliary ridge naman, ito yung bony structure sa kilay mismo. Okay? And we have another term, the frontal tuberosity. Tuberosity is also a protrusion. Protrude siya or prominence. Protrude. So, nakausli. Large rounded prominence on each side of the squamous portion. Halimbawa, ito yung noo natin. So, if you can feel that, so on each side, para medyo may matigas dyan na bony structure. So, nakausli siya. It is a prominence. We call that the frontal tuberosity or the frontal eminence. So, as you can see here, we have the frontal eminence. So, we have here, another one is here. So, dalawa siya. If you can feel that sa inyong noo. Then, we have the ito yung butas kanina, yung supraorbital notch. Ito siya. Saan dumadaan yung mga blood vessels para sa supply ng eyes natin, as well as the nerves. Then, we have the supraorbital margin. Ito siya, supraorbital margin. Then, we have where is the superciliary ridge? Hindi ko makita. Ito yung superciliary ridge, superciliary arch, or superciliary ridge. Ito siya. Superciliar arch or superciliary ridge, ito sa may kilay mismo. Sa taas niya, we have the supraorbital groove. Okay, SOG here, we have the SOM, then we have here the superciliary arch or superciliary ridge. Then we have here the frontal prominence or frontal tuberosity. So, we have here again the foramen or the notch. Then, between the eyebrows, we have the glabellar portion. Then, so yung margin dito is the SOM. So, we have also here, sa facial bones natin, we have here the glabella. Ito siya. The superciliary notch. Dito banda, yung butas or yung foramen. When we have here the superciliary arch sa taas ng kilay or the SOG, superciliary groove. Then we have the, what else? What else did we discuss? Wala na. Siyempre, the frontal bones. Okay? So, the rest of here, we will discuss next video natin. So, I will end it here for now. And I will continue to upload the succeeding discussion on the skull radiography. So, as of now, mag-end muna tayo dito. And I will continue na lang for the next slide. So, para hindi masyadong mahaba yung slideshow natin. And alam ko naman yung attention span nyo is medyo maikli rin. Okay? So, para makapag-rest muna kayo. So, ito na lang muna. Then, watch out. I will again upload the continuation of this later. So, thank you for watching and good day.